Good afternoon. My name is Alma Hughes of the Consumer Affairs Outreach Division of the FCC. Welcome to the FCC Older Americans Month Consumer Information Webinar. The purpose of this webinar is to share helpful information with older Americans, their families, and loved ones. And we have some great speakers who will share that information with you. Before I introduce the speakers, Ed Bartholomew, Associate Bureau Chief of the Consumer and Government Affairs Bureau, will share a few remarks with you.
Thank you, Alma. As Alma mentioned, I'm Ed Bartholomew, Associate Bureau Chief in the Consumer and Governmental Affairs Bureau. I want to join Alma in welcoming each of you to this webinar and thank you for taking time to join us today. Before I go any further, I want to thank the Consumer Affairs and Outreach team, and especially project leader Alma Hughes for their work in putting this event together. Our agenda features some great speakers, and we're confident you'll find the information we present today to be relevant and useful. Our goal is to provide each of you with actionable information to help you in your day-to-day lives. Recently, I had the opportunity to be on an FCC Rural Tour, where we conducted a series of meetings and events with local consumers and community leaders in rural areas. Efforts like the tour provide us with unique opportunities to interact with the public and not only share information, but also to learn and receive incredibly valuable feedback that can help to shape our educational materials moving forward. One thing that the Rural Tour reinforced for me was just how critical our individual relationships with telecommunications services are. A recent study found that members of the baby boomer generation are now spending just as much time on their smartphones daily as millennials, around 5 hours per day. That same study found that older Americans are spending less time using their smartphones for calls than their younger counterparts. We all depend on the internet and phone service to connect us to our loved ones, to help keep us informed and safe during natural disasters, and to provide a way to connect to our healthcare providers, our local schools, our local and national government officials, and keep us up to date on what's happening in the world. Today's event is timely. May 15th is National Senior Fraud Awareness Day, and during our program, we'll share some information about illegal robocalls and fraud. I did want to share an interesting trend with you. Recent studies are showing that younger adults are just as likely to become a victim of a scam as older adults. One recent study even found that men ages 18 to 34 were identified as most likely to fall victim to a scam and lose money. Perhaps again proving that older is often wiser. With that in mind, I have a request for each of you. Please take what you learned today and share it with those around you. Tell family members, friends about the scam calls you get and those you hear from others. Don't assume your kids or grandkids know how these things work and won't get caught by a scammer. Anyone can become a fraud victim, and we all have a shared responsibility to let those around us better know how to protect themselves. We can help you spread the word by keeping you up to date on the latest articles on our latest alerts and in a newsletter that we produce. If you want to be put on our email list, please send an email to outreach@fcc.gov. And as a request, we know that many of you serve officially or unofficially as leaders in your neighborhood, your city, or your state. We'd love to work with you on outreach campaigns that involve your place of worship, your local community, or your city or state. Please contact us at that same email address, outreach@fcc.gov, and we'll have someone contact you to see how we can work together to provide information locally in your communities. Before we begin, I want to reinforce some important information about how you can send questions to us today. Questions can be forwarded to the email address outreach@fcc.gov. If we have time during the presentations, we'll get the questions to our speakers. We do have a tight agenda, and if we can't get to the questions during the live webinar, we'll be happy to follow up with you individually and provide answers directly to you through email. Thank you again for joining us today, and without further ado, I'll turn it back over to Alma for introductions.
Thank you, Ed. Our first speaker, Jean Cadu, chair a sensitive auction task force, will share information on broadcast transition.
Thank you, Alma, and thanks to everyone who's listening for taking time to be here today and allow me the opportunity to tell you about important changes that are coming to the over-the-air television throughout the United States. Some local TV stations in markets across the country will be changing their frequencies over the next year or so, between now and July of 2020. These changes will affect viewers who watch TV with an antenna, either a rooftop or an indoor antenna. They don't impact viewers who watch TV using a cable television provider or a satellite dish provider or a master antenna system in a residence facility. So they affect consumers who watch TV with an antenna over the air for free. All of the local channels will stay unaffected as a result of this change, which is occurring because the FCC's work, one of our primary missions is to make airwaves available for consumer purposes and needs to serve the American public. We are making more airwaves available for public wireless use, meaning that we're consolidating and rearranging some of the television frequencies. This will make spectrum available for new wireless broadband services like 5G services, which are very important and which consumers are going to be very interested in having. Now, changing frequencies for your TV stations doesn't mean that your TV channels are changing. TV channels that you're used to seeing will still stay on your TV and have the same number, but the TV needs to be trained to find those channels on their new airwave frequencies. And that takes a fairly simple rescan process so that the TV will recognize when you tune to channel 4, TV knows where to find channel 4 in the airwaves. What viewers who watch TV with an antenna will need to do is be on the lookout for notices. Every station that's changing channels will provide a notice at least 30 days in advance of doing that they're going to be changing, and they will announce their rescan day. That's the day that you'll find that the station seems to have disappeared, and you'll need to rescan your TV in order for your TV to continue to pick up that station. Now, this is happening not all at the same time. It's happening at different times in different markets. So you have to be on the lookout for this perhaps more than one time over the next year or so. So watch for those public service announcements. You may need to rescan your TV multiple times during this period. Not every channel is changing, so some channels will never make those announcements, and other channels will. When you see those notices, make a note and plan to rescan. But if you notice a channel that you're used to seeing isn't there suddenly, it may be that you missed a notice. So when that happens, try rescanning your TV, and chances are that's what's happened. The TV has changed its frequency, and you'll find it again once you rescan your TV. Now, what is rescanning? Not complicated. When you bought your digital TV or you put a converter box on your old analog TV, you had to scan that box or your TV in order for it to recognize the frequencies in your local market area. And essentially what a rescan is simply doing that again. To rescan, what you'll need to do is find your remote control for your TV or your converter box, and look for something called menu or setup. And you go into that menu and you'll see something that talks about channels or antennas or auto-tuning or auto-searching. Unfortunately, manufacturers all use different terminology, so depending on what TV you have may determine what kind of words you'll see on your screen. But look for those types of words in the setup menu in your TV, and then click on that. What the TV will then do is go into a cycle where it will scroll through every channel in its lineup, and find out which channels are available to the TV in the local area. And it will find that, again, in my example, channel 4 is now on a new frequency, and it will adjust it to therefore know that when you turn your TV to channel 4, it'll find that channel for you. Now remember, if you have a cable provider or a satellite dish, you won't need to do this. Those providers will take care of this change in their networks. So this is only, you'll still see the notices on your TV, but you don't need to worry about it. Your provider will take care of it. So the only time that you'll need to actually do the rescan that you see notices of is if you have that antenna on your roof or an indoor antenna near your TV. So a good rule of thumb, if you're an over-the-air television viewer, is to rescan your TV periodically. You need to do it for this transition so that you be sure you keep getting this channels that you're used to. But if you haven't rescanned your TV in a while, what you may find when you do that is that there are more channels available for free over the air than you're used to seeing. That's because stations are bringing on new channels all the time. So rescanning your TV periodically is a good idea. Now, as I said, I think rescanning is not a complicated a technical thing to do at all, but if you have any questions or you have concerns about how to do that, we do have some help for you here at the FCC. Our website has lots of questions and answers. It has an interactive map in which you can put your street address and find out which stations in your local area are going to be changing and the time periods within which you should be watching for their notices. That website address is www.fcc.gov/TV rescan. I'll say it again, www.fcc.gov/TV rescan. We also have a call center where we have representatives who can help if you're still having trouble rescanning your TV, who can help walk you through the process and what you need to do. And the number for that call center is 1-888-CALL-FCC, which is 1-888-225-5322. And you press 6 and you'll get a live representative who can help you. The call center is available during business hours, actually from 8 a.m. until 1 a.m. Eastern Time, which means that viewers on both coasts can get access to the call center even after hours. If you're home in the evening watching your TV and you notice a channel is missing and you need some help, the call center will be there and you can reach it. Representatives are available in English and Spanish. And our website also has information in a number of other languages, if that would be helpful. So I commend those resources to you and urge you to watch for notices. Remember to rescan when you notice a channel is missing or when the rescan day of your local station comes, and hopefully it will be a painless process and well worthwhile to have helped us to free up the airwaves for wireless purposes. So thank you very much. Appreciate your time.
Thank you, Jean. Our next speaker, Dan Stepanovich, Attorney Advisor from the Enforcement Bureau, will share information with you on robocalls.
Thank you, Alma. I'm Dan Stepanovich, and the Attorney Advisor in the Enforcement Bureau, and I'm here to talk about everyone's sort of favorite topic, robocalls. Robocalls are the largest source of complaints to the Commission, and for many of these calls, they are illegal, especially calls to your cell phone. The Commission has taken significant action in the last several years on several robocalling schemes. That in total we have imposed or proposed forfeitures or financial penalties of $240 million. And these schemes have ranged everywhere from travel schemes and where the robocaller was marketing timeshare, travel vacations to essentially a travel timeshare scheme to healthcare insurance. So broadly, a big subset of robocalling, of course, is spoofing. This is where a robocaller will make the number that shows up on your caller ID appear to be a number that's very similar to yours. Often will have the same area code, and the whole purpose there is to make it seem like it's a local call, so that you will pick up. And so for the most part, these types of calls are the calls that are particularly troublesome and harmful to consumers. So what we do have several tips on what how consumers can protect themselves from these types of calls, and these tips can be found on our website at fcc.gov/robocalls. Our primary tip, of course, is to just not answer any call where you do not know the caller ID that is showing up on your phone. If you do pick up that call, then it's best. And then at that point, then you realize that this is a robocall. It is best just to immediately hang up and not to interact with the caller or any prompts that are told you to press. As in some cases, that might suggest that your number is a live telephone number, and then you will receive, in fact, more robocalls. If the caller is, for example, your bank or a government agency, our best advice is to again hang up the phone, and then consult the public number that it's on, either on the back of your credit card, or if in case of a government agency, where it is on the agency's homepage, and to call back for you to call back that number, that public number, as opposed to interacting with that scammer that may be sounding very convincing like your bank, but is in fact a scammer. And relatedly, in this case, in the IRS scheme, which is one of the most prevalent schemes targeting consumers, is that the IRS does not actually engage in those types of outbound calls. So any time that you're hearing the IRS on the line, it is most likely, in fact, is a scammer. Similarly, a popular way for these schemes to seek payment is through gift cards, and in this case, the U.S. government and legitimate companies are never going to ask for you to pay for services through an iTunes gift card or any other types of gift cards. Then finally, also, your phone carrier might provide several tools that can be used to either block these calls or to otherwise screen these calls. And for that, you can contact your carrier directly for how to enable those features on your phone. And in fact, today the Commission has further enabled your phone carrier to push out to more aggressive blocking of unwanted calls. There's also third-party apps that you can put onto your cell phone, and such as No More Robo, and so those are tools that can empower, that really can help you block a significant, a good portion of those unwanted calls. And again, those tools and resources can be found on our website. And then for any robocall you receive, it's always welcome to report that call to both to us at the FCC and also to our sister agency at the Federal Trade Commission, as those complaints that are filed to us give us real-time intelligence on what are the pressing schemes that are going on, and can in fact allow us to better target our enforcement actions. And in fact, all of our major enforcement actions that we have pursued have all been in part thanks to consumer complaints that have been sent to our consumer portal through the website or by calling. So that's pretty much most of the tips that I have for empowering and helping consumers, and stay tuned for further action from the FCC.
Thank you, Dan. Our next speaker, Ron Morey from the AARP, Senior Advisor, Community, States, and National Affairs, Multicultural Leadership, will share information on Asian Americans fraud.
Well, thank you. In addition to May being Older Americans Month, May is also AAPI Heritage Month, so it's appropriate that I talk specifically about AAPI, or Asian American Pacific Islander fraud. And want to highlight a recent survey that was done last year. The title of the survey is Facing Fraud or Saving Face, a survey of AAPI's 50+. And I want to share some of the statistics from this first ever study that AARP looked at in terms of the impact. Just sharing, nearly 4 in 10, so about 40% of AAPIs age 50 and older reported that they or their family members have experienced fraud schemes according to our survey, and that doesn't seem to be a surprise based on the conversation that we're having here. 1/3 of the victims, and this is what's a really shocking statistic, 1/3 of the victims lost an average of $15,000 per our survey. So we're not talking small dollar amounts. But again, I want to focus in on the most vulnerable, and anyone can be a target of fraud, as was mentioned, but there are some indicators that those with lower English proficiency may be at a higher risk. This is why it's really important for us to raise awareness in the AAPI community and in all multicultural communities around what to look for and ways to share some clues to prevent from our communities being victims of very sophisticated fraud schemes. Also, we want to highlight that our survey also found that there are non-financial costs. So I mentioned the average of $15,000, but there is a non-financial cost of fraud that cannot be ignored, and these issues can really impact a person's well-being and really should be dealt with, especially in communities with low English proficiency, where there's even a higher tendency for language isolation. And if you're a victim of fraud, this just compounds that impact. According to our survey, most fraud victims, about 72%, experience some sort of emotional, physical, or mental health impact. That included anger, stress, anxiety, difficult sleeping, and shame. So it's not often reported because it's something that they feel that they should have known better, but they fell victim to this, and they keep it internal, and it just internalizes. So we urge those who continue to feel shame or embarrassment or anger to really seek professional help. What can we do in terms of helping people dealing with being the non-financial impact of fraud? First of all, I would like to share that you're not alone, and that it's not unusual to experience these feelings of anger, shame, or embarrassment. to rechannel those feelings into action, volunteer to educate others about fraud, and especially in multicultural communities where language is key and culture. Again, you could channel that energy positively to volunteer to educate others, share tips with family and friends. And if you continue to feel the feelings of shame and embarrassment, again, as I had mentioned, make sure you open up and talk to close friends, doctors, and other professionals. If you or a neighbor are talking to somebody that potentially was a victim, what can you do? We have tips in terms of listening with an empathetic ear to the neighbor or loved one or family member, asking questions to better understand the situation and context in which the fraud occurred, keeping those lines of communication open. We always talk about social isolation at AARP, and this is key in terms of keeping that human contact and those lines of communication open. And remember to focus on frustration and anger on the scam and the bad guys, and not the victim. Again, these are very sophisticated fraud schemes, and we should be focusing the anger towards those that are causing these, not on the victim. Continue to listen for clues or continued participation in a scam, such as I'm going to win a lot of money, or the nice man on the phone. And if you're starting to hear these clues a couple of times from a loved one, then you should start probing and asking questions. There are materials that certainly the FCC would have, but AARP has materials specifically for multicultural communities. We've actually created a in-language Chinese brochure that is dealing with Chinese blessing scams, immigration scams, and these materials are free. It's our AAPI Fraud Prevention Handbook. And again, I think it's key for us to be talking about it, just as we have in this forum, but talking with family and loved ones. So I'm just going to highlight some real quick stats in terms of what are some of the most common types of frauds among Asian Americans. And again, these are frauds that are targeting AAPI's 50 plus. There's the foreign lottery scam, that's about 36%. Crisis-related donations, that's about 33%. This one's not uncommon. This is pretty universal, but it's tech support scammers offering virus removals. That's, again, 30%. We mentioned earlier the IRS imposter calls to collect back taxes. That was about 25%. So as you could see, there are very similar scams, but also nuanced scams. One that I want to highlight that was in the news quite a bit last year was the Chinese embassy scams, or for that matter, the embassy scams. The estimate was about 40 million that was defrauded from consumers. So this is really important to be aware of. And again, loved ones, neighbors, if you're starting to hear conversations with elders that talk about, I was contacted by the embassy, or I'm going to win a lot of money, I just need to send this check, those are all clues. And so what I want to just move into is what you can do as an individual and empower yourself. As was mentioned, the FCC has resources and phone lines that you could contact. AARP also has our Fraud Watch Network. And our Fraud Watch Network is both online, and I do want to highlight that. That would be just arp.org/Fraud Watch Network. And there's also a toll-free number that you could call, and that number is 877-908-3360, and you'll be put in touch with phone representatives that will capture this latest scam that you've encountered or you think that you're going to be encountering. You could report something that was suspicious, and you'll also be able to go online on the Fraud Watch Network site to actually see what are the latest scams or scam alerts in your geographic area, as well as get help if you are a victim, or again, you want to be empowered and report a scam so that others are not impacted. So these are all resource tools that are available to you, as well as specific guidelines. We have teletown hall calls on fraud prevention tactics that you could take. There are resources on the AARP site. So all of these tools and resources should hopefully make you feel empowered, as opposed to being a victim and not feeling empowered to where you could help not only yourself, but loved ones and family members. So thank you again, and appreciate the opportunity to share our information.
Thank you, Ron. Our next speaker, Chantel Virgil, Consumer Education Outreach Specialist, Consumer and Government Affairs Bureau, will share some FCC Consumer Health Center information.
Thank you, Alma, and good afternoon. As Alma said, my name is Chantel Virgil. I am the Consumer Educational and Outreach Specialist at the FCC's Consumer and Governmental Affairs Bureau, better known as CGB. I'd like to thank my colleagues and guests for discussing these important and timely telecommunication topics. To access more information on the issues discussed today and other topics, consumers should visit the FCC's online Consumer Help Center, which is a resource I'd like to talk about with you today. The Consumer Help Center is the FCC's online portal for consumers to get information on telecommunication issues and complaint filing. You can access the online Consumer Help Center at www.fcc.gov/consumer. Feel free to access the portal now as I walk through navigating the online site, or make a mental note to access the portal later. Most importantly, whether or not you have a telecommunication question or issue at the moment, we encourage you to visit the portal, browse, and familiarize yourself with the site as a potential resource for answering your telecommunication needs. Again, you can find the online Consumer Help Center at www.fcc.gov/consumer. The Consumer Help Center serves multiple purposes. Today, I'll highlight 4 areas. First, I'd like to direct your attention to several boxes of what I like to refer to as timely information. This means that we are providing resources and tips on a telecommunication issue we believe deserve your immediate attention. Many times we are trying to alert you of a particular scam that may be impacting a lot of consumers at the time, or the information can be advertising a new resource to help you with a telecommunication need. Today, you'll find timely information on avoiding telephone scams, such as our new video on spoofing. Other information you'll find is the TV channel transition, which was talked about earlier today, and getting connected to broadband. The second section I'll highlight is the Consumer Complaint Center. Clicking on this section will lead you to a different portal under the FCC where you can file an informal complaint concerning a telecommunication issue, check the status of your informal complaint, and share your telecommunications story. This FCC resource should be simple to navigate as well. The third section is the Consumer Data Center. This section will lead you to charts, maps, and other statistical tools representing the volume of complaints we receive on various topics. Here you can get an idea of how other consumers are experiencing telecommunication. Lastly, the fourth and final section of the Consumer Help Center is the Consumer Guides. This is the section that is probably most important to consumers. Clicking on the Consumer Guides will lead you to detailed information, tips web videos, downloadable information, and other materials on just about any telecommunication topic covered by the FCC. For your convenience, you'll find consumer guides organized by topics, or you can use the search box at the top of the page to find the topic you are interested in. If by chance you are unable to browse the Consumer Help Center, there is no harm in doing a simple search using your search engine such as Google to find FCC information. So for example, if I wanted more information about robocalls, I would simply search FCC robocalls or FCC unwanted calls. And it should lead you to FCC consumer guides and other FCC resources. At the Consumer Help Center, you can also find consumer guides available in other languages such as Spanish, Chinese, Vietnamese, Korean, and Tagalog. Consumers can also request consumer guides in an alternate format, including Braille, large print, or screen reader friendly. To make an alternate format request, send an email to fcc504@fcc.gov, and I'll repeat that, fcc504@fcc.gov. We most importantly want consumers to know that the FCC has information that can help you with your telecommunication needs, and the online Consumer Help Center is a great resource to seek telecommunication guidance. Again, you can access the online Consumer Help Center at www.fcc.gov/consumer. This concludes my time on the online Consumer Help Center. If you have any questions or concerns, please send an email to outreach@fcc.gov. It's been a pleasure presenting this information to you, and I will turn it back over to Alma.
Thank you, Chantel. Our final speaker, Dr. Chris Gibbons, Senior Health Advisor, Connect to Health, will share information on telehealth.
Good afternoon. Thanks for having me with you today. Let me tell you a little bit about the Connect to Health Task Force. The task force was started a few years ago here at the FCC to explore the intersection between advanced technologies like telehealth and health. Historically here at the FCC, the commission has been focused on telecommunications, largely outside of the health sphere, although they have had some health programs for a while. But as you may have noticed in society, in life in general, that advances in computers and technology and information are happening everywhere. We have computers in our pockets now that are phones, and we have computers not only on our desks, but increasingly our cars, and everywhere else there's more computing power, more hardware, more software. Well, that's happening in the health space as well. And more of things are becoming wireless. And so the FCC is involved in regulating, understanding, and promoting communication, whether it be wireless or wired. So they came together and formed this task force to explore not only what's happening today, particularly in the health space, but what might be happening in the future, and to make recommendations to how the FCC can stay ahead of the curve and help the society do better with its health. So why does this even matter in Older Americans Month? Well, I'm glad you asked. There are a number of reasons. One, you may have heard that every single day now, about 11,000 people turn 65 years of age. In just a few years, about 2025, I believe, 1 out of every 3 people living in this country will be over the age of 65. And by 2035, 1 out of every 5 people, fully 20% of the population, will be over the age of 85, or 80 to 85. So that's potentially 180 million people in just a few years over the age of 65, with a large number of them over the age of 85. There are not enough doctors, hospitals, nurses, nursing homes, skilled nursing facilities, or any other kind of health facilities in the country to treat all of those individuals when they need to be treated and when they want to be treated going forward. And so one question I often ask the groups that I talk to is that if we don't rely more on technology, whether it's wired technologies or wireless technologies, in our health delivery and health services, then how are we going to be able to touch every single person that needs to be touched in just a few years when they need to be touched? And every single time I ask that question, now it's been probably 100 or more times, I get the exact same answer, and it's blank stares. And that's because there is no other answer. We must rely more on technology for health and health care, not just of seniors, but absolutely of seniors. Well, what is this going to look like? What's going to happen? Well, it's going to change a lot of things. How many of you, if you were here sitting in front of me, we could make this a little fun, but I can ask you anyway, how many of you just love going to see the doctor? How many of you just love going down to the emergency room and waiting 8, 9, 10, or 12 hours before you get to see somebody? 12 hours is the average that people wait now in emergency rooms across America. How many of you just get all tingly inside when you get that bill after seeing the doctor or being in the hospital, and it's far larger than you ever anticipated for just what you thought was a minor procedure at the hospital? Well, advances in technology can help us deal with all of those things and help us lower the costs, help us reduce the waiting times, and in many cases eliminate waiting times, even for emergency care. And in fact, increasingly, it will eliminate the need to even go to a hospital to receive your care. You see, in the past, health care, we had to go someplace to get health care. But it's changing now, and in the future, health care will come to us. And it won't just come to us in another hospital. It won't just come to us in our homes. It'll come to us through technology, through our devices, in our homes, in our cars, through our phones, and no matter where we are, whether we're walking down the path or taking a vacation on the beach or at home. And that's one of the biggest changes that's going to happen in the future. And I know many people are saying, well, wow, is that going to be okay? Is that going to be, what's that going to look like? Well, imagine for a moment that you are able to talk to your grandson or your granddaughter anytime you want to and see them grow and develop. And even though you live thousands and thousands of miles away, it's almost like being there with them. That's exactly what it's going to be like in many cases in healthcare of the future. You may not be right next to the doctor that's seeing you or with the nurse that's helping you, but it'll be just like you were. And in addition to that, sometimes these technologies will work on their own without us having to do anything, and sometimes even before we know there is a health problem or concern. Sounds like something out of a fiction book, doesn't it? But it's already happening. It used to be that if you are having problems with your heart, you had to go to a hospital or a doctor's office or a clinic, and once you got in, then one of the many things they would do to you is to get what's known as an electrocardiogram or an EKG. EKG. And that was the only way it could be done. Once you got that done, then by the technician, it would be given to the doctor to read and interpret. And then at some point after that, if it was an emergency situation, relatively quickly. If it wasn't, it'd be a few days. The doctor would tell you what the EKG showed and prescribe some form of therapy. Well, today, you could still do it that way if that's the way that's available to you, but now millions of Americans, many of them seniors, can get an EKG just like that simply by touching a button on their phone, on their watches. Some watches have the ability to do that, or a button on a little pad that they can put on their table. Anywhere, anytime. So it's already happening, my friends. It's not just something that's in the future. And so we at the Connect to Health Task Force are trying to think about what that future really looks like, and in some cases trying to design it today. We have one project that we're focusing on in seniors living in Appalachia and Kentucky, and they are struggling with cancer at cancer rates that are much, much higher than the rest of the country. We don't really know why, but we feel that these advances in technology, even the ones that we have right now, might be able to do something to help them right today. And so we have a partnership with a number of organizations around the country where we're trying to design this next generation healthcare system. You see, up in those mountains of Kentucky, they don't go to the doctor every day. They don't go to the doctor every week. In fact, we were talking with some of them and they said during the wintertime, there's so much snow up here and the roads are so treacherous, you don't not only not go to the doctor, you don't go anywhere for 3 or 4 months. You might come out once or twice over 3 or 4 months, and if you do, there's only 2 places you're going. One is the post office, 2 is Walmart. So what do we do? How in the world can we help people if they're not coming out? Well, technology is helping us. We're designing a system that we think will prove that this works for people over the age of 65, as well as those under the age of 65. So in a nutshell, these are exciting times. They're different times. They will involve differences, but they're exciting times, and at the end of the day, will hopefully make things better for older Americans, for younger Americans, for families all across America. Thank you very much.
Thank you for that. Well, this concludes our webinar for today, and we want to thank you for attending. Again, if you have any questions, please email them to outreach@fcc.gov.